So the first part of chapter 8 was talking about cryotherapy. Now we're going to talk about thermotherapy. And in this chapter, we're specifically talking about superficial cold and heat applications. So things that we do on the surface. We will talk about some other modalities later on that are more deep heating therapies, such as ultrasound and diathermy. But we're talking about superficial cold and heat here. And so now we're on to superficial heat, thermotherapy. So the learning objectives, we want to be able to describe or explain how thermotherapy controls pain, increases range of motion, decreases joint stiffness, and accelerates healing. We want to explain the significance of specific heat and thermal conductivity in the application of thermotherapy, contraindications and precautions, of course, and how these physical agents may be potentially harmful. And we want to describe the potential adverse effects of thermotherapy. Thermotherapy is another modality that is not billable, like the superficial heat anyway, like cryotherapy, superficial cold. So we still have to document it though if we do it, and we have to think about how we're going to fit it into the session as non-billable time. So physiologically, thermotherapy has a lot of cool effects. It has hemodynamic effects, neuromuscular effects, increases metabolic rate and tissue extensibility. So its hemodynamic effects are exerted through vasodilation. The neuromuscular effects are exerted through changes in nerve conduction velocity and firing rate. It increases them. It increases your pain threshold, and there are some changes in muscle strength that we will talk about. And it increases metabolic rate and tissue extensibility. So a lot of people who do hot yoga, no, hot yoga is as popular as it was for a while, but people would say like you do yoga in like a 105-degree room. And I've been to hot yoga and it's torture as far as I'm concerned. But people always say to me, or I've heard many, many times that, oh, it increases your flexibility. And to some rate, it does increase tissue extensibility. But I believe, this is my personal opinion, that the effects of hot yoga are more pronounced because of the increased pain threshold. So you can get into positions that you normally wouldn't be able to because it increases your pain threshold, and it kind of dulls your sensitivity, rather than actual increased tissue extensibility. So, okay, my opinion, there you go. I'll throw that in for free. So heat causes vasodilation, but that increased temperature causes some inflammation. It stimulates cutaneous thermoreceptors. So the inflammation increases vasodilator release, so histamines and prostaglandins, and that causes vasodilation. The cutaneous receptors, thermoreceptors, affect the spinal cord dorsal root ganglion, which decrease sympathetic androgenic activation. That is part of the pain management effect. It relaxes smooth muscle, and remember those precapillary sphincters are smooth muscle, and it causes vasodilation. So heat works to vasodilate just like cold works to vasoconstrict. So ask yourself, do I want to vasodilate or do I want to vasoconstrict? And a lot of times that can be the choice between cryotherapy and thermotherapy, superficial. So we're going to use it for pain control a lot of times. For one thing, the positive experience of heat can help relax you, that decreased sympathetic response, and that can contribute to pain control, and the vasodilation. Increased range of motion and decreased joint stiffness is very common with thermotherapy. If you have someone who's immediately post-surgical, you don't want to use thermotherapy to increase joint range of motion and decrease joint stiffness, because you already have an inflammatory process going on and you're going to make more inflammation, and that's going to restrict your range of motion. But superficial heat also accelerates healing. And if a low load prolonged stretch with heat, like is shown in this picture, can be really helpful for constricted tissues and contractures. So a long time ago, I worked with a gentleman who had elbow flexion contractures. because of the way he was positioned. And we would start out with superficial heat, and then we would do deep heat with ultrasound, and then we would do soft tissue mobilization and manual stretching. And we did get him to the point where he could manually propel his wheelchair. So that low load prolonged stretch with heat was a really sort of benign thing that the nursing assistants could do before his therapy session. Um, and then he could come into therapy and we could do the rest of it. And we really got some good range of motion restored in his joints. So it was well worth it to use the thermotherapy. So precautions and contraindications. Contraindications, hemorrhage. If you're bleeding, you don't want to increase vasodilation, right? You want the opposite. Thrombophlebitis. So if you have blood clots, not a good thing. Impaired sensation and mentation, as always, but with heat, particularly so, because if they have impaired sensation, they might not realize they're getting burned, or impaired mentation. Malignancy, because we don't want to increase circulation in the area of the malignancy. And infrared radiation of the eyes, we're not going to do that. That seems obvious to me, but there you go. There it is on the list. Precautions, acute injury or inflammation, because we don't want to increase inflammation and increase vasodilation. Pregnancy, pregnant women are always warmer because they have that extra person and extra circulation. And so heat is often intolerable. And pregnancy is almost always a precaution for everything. Impaired circulation, because you're going to increase vasodilation, you already have impaired circulation. Those two don't go together. Edema, because it's going to increase edema. Cardiac insufficiency. Anytime you're messing around with vasodilation and fluids, the cardiac system has an overload and it's going to have to take that up. So if you already have cardiac insufficiency, thermotherapy might be a little too much. Metal, like we said, you should take off necklaces and whatnot. If you have even metal implants, thermotherapy might make them feel warmer, might be uncomfortable. Open wounds, because we don't want to increase bleeding in those open wounds. A topical counter irritant. So if you have like capsaicin or something on your skin and you put a hot pack on top of it, it might make it way hotter, way worse. Demyelinated nerves, because you're getting impaired sensation in that area. So you're kind of back to the impaired sensation. So lots of precautions and contraindications for thermotherapy. The potential adverse effects of thermotherapy, burns. And in fact, there was an article a few years back from the APTA that burns or adverse effects from hot packs were the most reported adverse effect from any type of therapy. So you've got to be super cautious about that. Fainting and bleeding. Bleeding because you have increased vasodilation. Fainting, I don't know exactly the cause of fainting from thermotherapy, but it's a potential adverse effect. And skin or eye damage from infrared. We don't really use infrared that much anymore, so it's not as big of a thing. If you're using low-level laser light, which we'll talk a little bit about later, you often have to protect your eyes from that. But if you're using infrared heat, then skin or eye damage could be a potential adverse effect. So a lot of times we use the hydroculator packs, which are shown here with the we have those in the lab and we'll practice using them a little bit. And there's a PhysioU simulation where we talk about hydroculator packs. You always want to record the initial temperature of the hydroculator before you apply the pack. And there are lots of precautions about how many layers of towels you put in and that sort of thing. And those are all listed in your book and in your lab manual. So we will learn the proper technique at the lab. Paraffin is paraffin and fluidotherapy. I often see used with OT for hand therapy. For a long time I've worked with several OTs who are certified hand therapists, and they use these a lot We don't use them as much in PT, although I have worked in PT clinics where we used them a little bit more. I like paraffin as a spa treatment. Just, just fun. But these are probably less commonly seen in the clinic these days, unless you are working in a place that does hand therapy specifically. So documentation, we are going to include the area treated, what heating agent we used, the parameters, so temperature, power, insulation, distance, any parameters involved, including the temperature of the hydroculator when you took pack out, and patient positioning. Were they supine with the pack under them? Were they prone with the pack on top of them? However, you're going to do that. And their response to the intervention. And it's a no charge treatment. So if somebody reports that you have them on hot pack and they say, oh, it's getting way too hot, you want to check their skin, remove the hot pack, and document. So that's you might add, if their skin is fine when you check it, you might add more layers of insulation. But if their skin is really red or anything like that, you want to remove the hot pack and document that you did it. So this is the therapy that we looked at before. We're going to choose thermotherapy when we want to decrease pain and muscle spasm, increase blood flow. We're not going to use it for edema. We're going to use cryotherapy. Um, we're not usually using it to increase nerve conduction velocity, but you could probably think of a situation when you might. Usually we're using cryotherapy to decrease nerve conduction velocity to decrease pain. Increase metabolic rate to improve healing, yes. Increase collagen extensibility to improve range of motion, yes. We're going to use that. Decrease joint stiffness, you definitely use thermotherapy for that. And probably we're not going to be using it in the case of spasticity. So lots of uses for thermotherapy, lots of precautions for thermotherapy. So keep all those in mind.